I'm Dr. Rastogi. I'm a psychiatrist specializing in anxiety disorders at the Northside West Clinic. Today I'm going to be talking about anxiety disorders. There are multiple causes of anxiety. There's not one cause for any psychological disorder. As we say, genetics play an important part in anxiety. There have been actually 6 genes that have been identified for anxiety. Other factors like personality protypes. Some people are more prone to anxiety than others. So personality types such as being shy, avoidant, obsessional, or perfectionism, they are vulnerable personality protypes that increase the risk of anxiety. Environmental factors like stress and trauma play a very important part in the lead up to anxiety. There are certain medical conditions like thyroid disorders. They play an important part in anxiety, and of course recreational drugs also contribute to anxiety. So as you can say, it's quite an assorted basket and it's multifactorial. Anxiety has different ways and forms to start. As we know, there's acute anxiety. That's usually a portal time to get help. Acute anxiety mainly presents as what we call as panic symptoms with quite severe physical symptoms where you have a feeling of impending doom. And that usually leads to get help either to see a general practitioner or go down to emergency with the fear of either having a heart attack or something sinister happening. Generally, there can be triggers or it can be without a trigger. And following an acute anxiety, there are chronic symptoms, mainly fear and avoidance, which are quite debilitating more than the acute anxiety. So when a person is diagnosed with anxiety, we recommend that they see the general practitioner as the first port of entry to get ongoing further help. So we talked about the acute anxiety, which is termed as a panic attack or panic disorder, where you have physical symptoms such as sweating, increased heart rate, palpitations, pins and needles, feeling of dizziness, and they mimic a heart attack or something sinister happening. After an acute anxiety attack, which can last for about half an hour, 2 hours, or even longer, you can have chronic symptoms of anxiety, which are usually fear and avoidance, a lot of thought processes like ruminations and sleep problems and motivation. Then it can be the mild, moderate, or severe anxiety depending on the symptoms and also the triggers that cause that. They need to see the general practitioner as the first port of contact. What the general practitioner usually does is go through a list of their symptoms, identify if there are any medical causes by doing some blood tests, and if there are no other medical causes, then commence treatment. And the usual treatments are either referred to a psychologist if it's a mild anxiety, or sometimes augmenting it with medications such as antidepressants. If the anxiety is quite moderate, severe, complex, then a referral to a psychiatrist like me is made. And in severe cases, admission to hospital is considered for safety as well as medication monitoring. So these are usually the ports of getting treatment for anxiety disorders. Social anxiety is a subtype of anxiety where you have anxiety mainly in social situations. So it is based on the fear of being criticized or judged socially. And certainly in this day and age with smartphones and other gadgets, it's a very common problem, and perhaps in the next few decades, an increasing problem which we have to deal with. It certainly is associated with a lot of electronics and young adolescents where they are isolating more and more in their room and having decreasing social skills. It is going to be a big burden on society with the young generation developing poor social skills over time. Anxiety has quite a significant physical component. It is based on when we are exposed to threat or serious trauma, then our body generates a fight or flight response. This is a natural survival kit we have. And when we are into the fight or flight mode, our body releases stress hormones called cortisol, which in turn causes physical symptoms. These physical symptoms can vary depending on how intense the symptoms are. These include, as we sweating, palpitations, dry mouth, dizziness, and butterflies in your stomach. And these are commonly quite debilitating for someone. So this is why the physical symptoms of anxiety are more pronounced as compared to other mood disorders. The best time to address anxiety disorder is in the acute phase or really early on of your anxiety road. It is very important that if the anxiety is not treated early on, it leads to chronic impairment. So it's best, as soon as an anxiety attack happens or the symptoms of anxiety, it's best to see a doctor or your general practitioner and get help early on, because it has the best response rate and relapse prevention. Anxiety disorders are reversible provided the right treatment and a comprehensive plan is provided, and the outcomes are generally very good. It is one of the disorders which appear to have good response to treatment, and full recovery is possible. Anxiety is not harmful to all of us. We all experience anxiety at some point of a time. Anxiety disorders are different to anxiety. Anxiety is a protective factor because it helps us to motivate us, it helps us to move further and challenge our survival skills. It only becomes debilitating when it becomes a disorder and it's associated with fear and avoidance. Anxiety does have a significant genetic component. Recently, there have been 6 genes that have been identified for anxiety disorders. Anxiety does run in families, and it is passed on to the offspring if both parents have a history of anxiety disorder. So there is a genetic basis to anxiety disorders, and it does not mean that if you have the gene, you will have anxiety, but it increases your vulnerability and predisposition to anxiety in the future.